Snakes and Ladders. It's a game everyone knows and loves. Originally called Moksha Pratam in North India, it was created in the 2nd century AD and focuses on a life journey complicated by virtues, which are the ladders, and vices, which are the snakes. The game focuses on identifying your goal, accepting outcomes, keeping on moving, and controlling the risk and not the reward. Indeed, people pray not to land on a snake rather than praying to land on a ladder. It was popularized in 1943 by Milton Bradley, who's the pioneer of the board game industry, and he commercialized this in the UK and the US. And Snakes and Ladders really predates any formal system of language, education, politics, and even common law. Initially, it was meant to reinforce the teachings of Hinduism in a practical way without having to resort to physical books, and designed to teach and communicate through experience. So the question was, can Snakes and Ladders actually influence behavior, and can board games influence behavior? So a study last year by Professor Mitsuhiro Nako looked at this very phenomenon. In a randomized control experiment comparing teaching through traditional methods as well as teaching through board games that promoted health education, he found that over 2/3 of participants had a higher knowledge-based test score 3 months after this intervention. So the next question was, how can we leverage that concept to bring key education to those who need it most? Meet Victor Otineo, a 14-year-old from Nairobi in Kenya. His parents live on around 400 Kenyan shillings a day. It's about £3. And his attendance record at school is less than 20% due to the inability of his parent to pay regular school fees. He studies at Gachoka Primary School on the outskirts of Nairobi. It's a public school with about 120 pupils, focused on art, English, and maths, as well as teaching children childcare, cooking, and general exercise. So it's focused on the core subjects in the classroom, but sorely missing the physical, social, and health education that we fundamentally take for granted in the Western world. Indeed, PSHE isn't really a concept in Kenya. It's not part of the curriculum of schools. In 2015, the Kenyan government realized this and published a plan called the Education for All Act. They identified key areas of improvement. They found that students had inadequate knowledge on values and life skills. There was indulgence in risky behavior, especially drug abuse, and negative peer pressure. There was inadequate communication skills, and there was a lack of capacity, information, and role models that children could really look up to. This all led to about 25% of primary school-age pupils not even enrolled in school, leading to 1.2 million illiterate population. Drug abuse was the key issue. The awareness rate was so low, 20% of participants aged 9 to 15 understood the dangers of drug abuse. Alcohol, cigarettes, and cut, which is similar to speed, had positive associations in 73% of the student population. And shockingly, the median age for the first use of these drugs is just 9 years old. So this is Charles Macharia, a trained social worker in the UK and a Kenyan national. He is a social and academic counsellor for 4 schools in Nairobi, and in 2008 he started the MASH Foundation Trust, focusing on sponsoring pupils throughout the education system in Kenya. He set up programs to empower, educate, and support communities, especially orphans and vulnerable children in Kenya. And I've been working with Charles since 2013 as part of a program to bring international volunteers out to Nairobi and teach life skills, health, safety, hygiene, drug abuse education, and morals to children. So we sat down after our trip to Kenya in 2013 and looked at how we can sustainably and scalably teach life skills and impart these learnings to children in a scalable fashion. So we thought, let's take a concept that everyone knows so well and repurpose it for social education, particularly on drug abuse. So we adapted well-loved, highly visible board games that children already play in a social context and infused a moral element to these games. So we created Ludo and Snakes and Ladders with a difference and with a purpose. It's almost going back to the 2nd century concept of virtues and values through board games and stripping away the commercialization that's happened in the following centuries. So here you can see our drug abuse and healthy living Ludo and road safety Snakes and Ladders. created and printed locally in Kenya with the purpose of leveraging board games to influence behavior. Focusing on drug abuse to start with, as our target was to increase awareness and promote positive peer pressure and change that positive association with hard drugs. We took the key findings from the Education for All report, focusing on the key areas of weakness, and mitigated those themes through these board games, focusing on reinforcing good behavior, raising awareness of key issues, and teaching this in a fun, engaging way that students would actually remember, and teaching through a collaborative manner as opposed to just talking. So we got approval from the Ministry of Education and did a limited print of these games that we then launched in 14 schools around Nairobi. So once we got the approval from the Ministry of Education, we then took these board games out into schools. We started with 3 pilot schools, Gachoka, Kasarani, and Gianchiru, covering over 300 students, focusing on the ages of 9 to 14. We split children into groups of 5 to 6 and literally played board games with them as a fun and social activity. We saw that kids were extremely engaged as they loved the concept of having fun while they were learning. Crucially, we followed up with schools and the community after our pilot program to see the impact. And it was amazing. Positive attitudes towards hard drugs had dropped by 60%. We found that peer pressure caused a cyclical effect. Children now had role models within themselves, and they were reinforcing their own good behavior, following the crowd in a good way. And among the adult population, we saw reverse teaching. Kids were taking these board games home and talking about their learnings with their parents, resulting in a 70% awareness increase in the adult population on substance abuse in these communities. And therefore, we created a cyclical and sustainable learning pattern that covered generation to generation on the dangers of substance abuse through a very, very simple concept. We didn't need major socioeconomic studies. We didn't need a complex education training regime. We didn't need to overcomplicate the number of stakeholders involved. We just took a very simple concept of board games to influence student behavior. And in the next year, we're expanding this initiative out to Tanzania and Uganda, as well as augmenting our board games with additional topics, in particular focusing on hygiene and hand washing. As Leonardo da Vinci once said many years ago, simplicity is the ultimate form of sophistication. We took a very complex socio-economic problem in Kenya, broke it down into its fundamental layers, and created an initiative that caused maximum impact. Resources were simply not a constraint for us. We just had to be smart in how to utilize, allocate, and leverage what we had at our disposal to add value to the communities. It's easy to be complicated, but simplicity is really an art. And I hope that this small initiative in board games has demonstrated how impactful that ethos can be. Thank you very much.